So with regards to exercise prescription and modifications for lower back pain clients, we always follow the progression of first, we train flexibility. So we do a full analysis of someone's body biomechanically, and we make sure that they're stretching all of the tight areas. We then focus on stability. So again, making sure that all the key stabilizer muscles in the body are working effectively. Only once we've developed a good level of flexibility and stability should we then begin to focus on strength. And then once we've focused on strength, then we need to apply power so that the person can go back to their everyday environment and they're able to survive that environment without getting re-injured. So some key considerations that we need to consider. Number one, we need to assess flexibility and stretch whatever is tight. We need to correct posture, both static and dynamic. We need to get the inner unit functional, and again, that might include looking at diet. We need to develop stability using isolation and then integration. We need to evaluate and correct ergonomics. So this is an area that's really, I would say, underrated. If you think about someone that might be doing corrective exercise for say 3, 4, even 5 hours a week, if they go and sit in a job where they're working 40 hours a week with really poor ergonomics, so they're sat in a poor chair with their spine in a bad position, then your exercise program is never going to undo. If you're exercising for 3 hours a week, that's never going to undo 40 plus hours of sitting with really poor posture. And it could be sitting 60 hours of really poor posture. So clients really need to be educated with regards to their ergonomics, probably even more importantly than their exercise program. And then we need to focus on building outer unit strength. As I said, we've really got to make sure that our clients can go away and survive their environment and not get re-injured. Once someone is out of pain, that is not the end of their rehab program. Their rehab ends when they're strong enough and powerful enough to survive their sport or work environment. We also need to make sure that our clients are avoiding pain. So things like if someone has a disc bulge, then, for instance, you want to probably initially make sure that they're avoiding flexion of the spine, otherwise that's just going to cause them more pain. And you want to monitor the effect of the exercises from workout to workout. You want to make sure that anything they're doing isn't exacerbating their problem. And again, you want to consider all aspects of the totem pole at all times. Now, if we look at specifics for degenerative disc disease, we want to combine the forces with a rehabilitative professional and massage therapist to develop an effective program of stretching, joint mobilization, and mobilization with exercise. We need to strengthen all the muscles crossing the joints involved and pay specific attention to the stabilizer muscles. We need to select using slow tempo exercises, positional isometrics, and high resistance. So we want the volume to be low, and we want to minimize the wear and tear in the joint. And we also need to evaluate for correct posture and again for ergonomics. For a disc derangement or disc bulge, again you want to make sure that you're avoiding pain, and this may mean you need to prevent the amount of flexion of the spine and certainly side flexion away from the pain as well. You'll probably find that most patients won't even want to do that in any case. We need to avoid initially axial loading, so that means putting load through the spine vertically. Again, because you're creating more compression through the spine, you could be compressing on a disc and making it bulge more. You need to be aware of sympathetic overload, so sweating coupled with dizziness and/or nausea or vomiting. You always want to maintain a level of lordosis with any axial lifting postures. So once you start getting them doing anything like squats, for instance, you want to make sure, particularly initially, that they're doing that with a lordotic lumbar curve. And also you want to maintain a lordosis with all abdominal exercises. So that might include using a towel under the lumbar spine. It might be using a hand under the lumbar spine, or even a blood pressure cuff pumped up to make sure that they're not going into flexion. And you may want to end all workouts with 1 or 2 sets of lumbar extension type exercises, again, just to help centralize the disc. And also remember that a disc can take around 500 days to heal. So care must be taken not to re-injure the disc during that time. For a spinal stenosis, you want to make sure that you're avoiding extension of the lumbar spine. You want to strengthen all muscles crossing the joint involved and pay special attention to stabilize the muscles using exercises such as horse stance and inner unit exercises. You also need to educate them on using correct posture at home, at work and for sports. Again, you want to evaluate their ergonomics. And for spondylolysis and spondylolisthesis, you want to restore full function to the abdominal wall. Restore full function to all the intrinsic stabilizers of the spine. Do lots of postural training, standing and seated, both static and dynamic. Again, evaluate their ergonomics. Avoid end range flexion, extension and rotation. So you want to avoid all extremes of range of motion, especially when the spine is loaded. And you want to develop strength with functional lifts. So exercise prescription and modifications for lower back pain clients, you want to avoid administering exercises to clients using pain medications. You also need to be careful of non-steroidal anti-inflammatories. These drugs will often mask the symptoms of pain, permitting the clients to perform exercises in ranges of motion or intensities that are outside their actual capacity, often resulting in painful setbacks. Remember, pain is a communicator. It's a signal to tell you that something's not right. If you're numbing down that signal, you've got no way of knowing where your limitations are. So always recognize the boundaries of your care as a fitness professional. Learn how to identify clients who need professional help beyond your expertise, and understand which allied health professionals can help outside of your scope of practice. It's a really good idea to go around and interview a number of people who you think might be able to help you, and if possible, even get treatment from those people to see how good they are, but also use people that come with good recommendations as well. And of course, continue to educate yourself to stay informed and knowledgeable. So in conclusion, what is the cause of your client's lower back pain, if identifiable at all? You need to know if it's acute or chronic. What assessment or treatment has the client already received? If they've already received a particular type of treatment and it hasn't worked, there's no good repeating the same treatment. Have they been cleared for exercise by a medical professional? You need to make sure of that before you take them on. And has the client any identifiable issues higher up in the check totem pole that may need to be addressed? And again, you might find that you're going to need to refer that person out in a lot of cases. So you need to decide for yourself, are you the right person to help that client, or is someone else in a better position than you? So that's it for this presentation. I really want to thank you for tuning in, and hopefully I'll see you again soon on another presentation.